Hello everyone. Assalamu alaikum wa rahmatullah. This is a quick session or quick video regarding the management of shoulder dystocia. This is stationed in the teaching module. So now you are the ST5 in the department and you are about to meet the ST1 Jane McDonald. She's here because she wants to discuss the management of shoulder dystocia as she was involved in a case yesterday in the labor ward. You will be assessed in the following domains: information gathering, patient safety, applied clinical knowledge, and communication with the colleagues. Usually here, the information gathering, this is teaching station. So this domain, you will be assessed regarding what? Regarding the information you will gather from the ST1. So how is everything in the department? You recently joined us just to gather information, more information about the ST1, and also to check and to exclude any problem with the ST1 like undermining or bullying. Patient safety points in the management of the shoulder dystocia, applied clinical knowledge as well. It's the management, communication with the colleague. So it's the communication with the ST1 at this time. For the introduction, very simple. Hello, I am, and mention your name. So hello, I'm Rana. Is it Jane? Or you can ask and you, so you can know the name of the ST1. For the agenda, information gathering together. So the agenda, you want to know why the ST1 needs this session today, and also you need to exclude, as I mentioned, the undermining or the bullying. So you will start like, I know that you recently joined our department, is that correct? And then how's everything here? Are you happy with us? How is your training process? All these questions just to exclude any problem like bullying. So I understand that you want to discuss the management of shoulder dystocia. Is that correct? Yes. So what is the reason behind that? Or would you please tell me why you want to learn more about this topic, especially? And then check all the old information or old knowledge. So did you read about that before, or what do you know about the shoulder dystocia? So let's discuss it together. And at any time, if I'm not clear, please don't hesitate to stop me and ask me to repeat. So now you are making like a good communication with the ST1. Any station in the teaching or structured discussion for any topic, usually you have to start with the definition. So first of all, you need to define what is the meaning of shoulder dystocia. So shoulder dystocia is one of the obstetric emergencies, and it is when the baby's shoulders stuck behind the mother's bone. Okay, how are we gonna diagnose the shoulder dystocia? If the head now is delivered and the shoulders don't deliver after 60 seconds. So between the head and shoulders, it has to be less than 60 seconds. If it's more than 60 seconds, so now this condition named shoulder dystocia. Another thing to diagnose, not only the delay, we can diagnose with the turtle sign. Very important sign. You will diagnose the shoulder dystocia with that. Another sign, failure of restitution. If you remember the mechanism of normal labor, the last step is the external rotation and restitution. And this is because of the movement of the shoulders on the pelvic floor muscles. So when the shoulders is moving inside, so the head starts to do external rotation and restitution to look at the mother's side. So if there is failure of restitution, this is another sign to diagnose shoulder dystocia. So turtle sign and failure of restitution. And what about turtle sign? You will find the head of the baby retracting and applied tightly against the maternal vulva. Then check understanding every now and then. Am I clear so far? Yes. Can you repeat what is the definition of the shoulder dystocia? Or what about the time between the head delivery and shoulder delivery? Just to check that the ST1 is communicating with you and he's following you. And don't ask to repeat for more than 2 times maximum. So ask 1 to 2 times, not all the session like, would you repeat? Would you repeat? So it will be not, it will not be good for you. Then you will tell the ST1 that we cannot predict, or we cannot say like this patient will have shoulder dystocia, but we can say that this patient has risk factors to have shoulder dystocia. So we have pre-labor factors and intrapartum factors. For the pre-labor, it's previous shoulder dystocia, increasing the risk tenfold. So take care of that. Macrosomia more than 4.5 kilogram. Diabetes, maternal body mass index more than 30, BMI more than 30. Induction of labor itself will increase the risk of shoulder dystocia. Intrapartum, prolonged first stage, prolonged second stage, secondary arrest, oxytocin augmentation, assisted vaginal delivery. So we have here 5 risk factors, and here 5 risk factors, pre-labor and intrapartum. If you can find any of these in any patient, so suspect that this patient will be at risk to have shoulder dystocia. We have here like mnemonic letters just to remember how we're going to manage, but actually I love the algorithm. So we will go through the algorithm and then we will discuss all steps together. So the mnemonic: help, error. So help, call for help, evaluate for episiotomy, E, L, legs, elevate the legs, pressure, P, enter vagina with finger. This is the internal maneuvers, remove the arm, rule the patient. So just to go step by step. So if you will study shoulder dystocia, this is my advice to go. We will read all this, but first of all, we need to go with the algorithm. So it will be easy, even just before the exam, one day before the exam. Just revise all the algorithms you have. So management of shoulder dystocia. Number 1, call for help. So I need to call more staff. I need to call the consultant or the senior. I want to call the midwife coordinator or the labor ward coordinator. I want to call, or I need to call the neonatal team, pediatrician or neonatal team as a whole, anesthetist as well. And I need to call more staff and more nurses. And I will ask one nurse, she will be only for documentation. She will start to document when we diagnose shoulder dystocia. And what about the anterior shoulder? Is it the right shoulder or the left shoulder? And now we will start to do the maneuvers. So when we start, for example, macropers, it's done around 9:30. And then suprapubic pressure, 9:31, and so on. So with timing, she will document everything. After call for help, don't start the maneuvers immediately. We will go to the woman. Now, this is the mother, and she will find a lot of things done for her, the maneuvers, I mean. So we need just to speak with her that now we have a condition named shoulder dystocia. Now the baby's shoulder is stuck behind your bone, and we will try to do some maneuvers just to help the baby to come out, or to help the shoulders to come out. Is it okay? Yes. Ask her to not to push. Discourage pushing at any stage of the management of shoulder dystocia. I will remove the pillow below her head, and I will ask her to come to the edge of the bed. If the bed is composed of 2 parts, just I will remove the part at the end of the bed. So now the patient on the edge. Okay. Then I will start to do my maneuvers. First maneuver is Macropert's maneuver. And this Macropert's maneuver, it's like flexion, abduction of the mother's hip joint. Okay, so I will bring the thigh of the mother to the abdomen. Okay, the success rate of this maneuver around 90%. So most of the women will be delivered here. How I can do this, or for how many minutes or seconds? It will be only for 30 seconds. Then if failed, I will move to the second maneuver. The second maneuver will be suprapubic pressure with the Macropert. So together, success rate here, 97%. And I will ask the assistant just to make the suprapubic pressure for me. Okay? Ask the woman every now and then, don't push. If this fail, suprapubic pressure 97%. So it's only 3% will fail to deliver. So I will consider here episiotomy, and I have to just tell the ST1 that this shoulder dystocia is a bony obstruction, and episiotomy will not help with the bony obstruction. However, it will help me to do internal maneuvers or to deliver the posterior arm. Which one I will start? Next step will be either delivery of the posterior arm or internal maneuvers. So it will depend on your experience. It will depend on the whole situation. No, there is no preference for one maneuver over the other. Choose whatever you want. And then if this fail, I will go for the next step, which is the all four position. And if all four position, I need two things here: that the mother is slim and no epidural. So if the mother on epidural anesthesia, she cannot be on all four position. Okay? If failed, I will repeat all the above. Am I clear so far? Start every now and then you will ask, am I clear so far? And if you have the face-to-face exam, ask the ST1 to do the maneuver. So do the macropers in front of him, then ask him to repeat. Can you do it for me? 1 or 2 times, and that's it. After that, we have some destructive measures, but it's the job at this time of the consultant or the senior, and it's their decision. Okay? Don't dig more about the names of the destructive measures, just destructive measures for the mother or for the baby. Okay? So now this is the management of shoulder dystocia in the algorithm. If you will follow the algorithm, so you will not miss any point. In every step, you will tell the ST1 about some points, like the success rate and how we're gonna do it. Okay? And for how long. Every step or every maneuver, we will take 30 seconds, and then we will move to the next one. Okay? And so on, 30 seconds, move to the next one until we are at the end. So we can repeat all the steps again. And if failed, so at this time, we will go for destructive measures or destructive maneuvers. Okay? Coming back here to the explanation. So we will continue each step or each maneuver for 30 seconds. Very important to tell the ST1 like that. We need to call for help. Okay? We need to call the consultant, the senior, midwife, extra staff, especially for the nurses, just to document what will happen and at which time and which shoulder is delivered or which shoulder is the anterior. For example, the anterior shoulder is the right shoulder. So if this baby will come after that with the Erb's palsy, so I know this shoulder affected because of the shoulder dystocia. Okay? I will ask I will go speak with the mother, ask her to lie flat, remove the pillow, don't push, come to the edge of the bed. So this is your job with the mother. After that, you will start to do macro-Roberts maneuver. And if you have face-to-face exam, so you will ask this question, do you want to do it? Or would you please do it for me? And you have to mention, what about the success rate of this maneuver? And then next step will be the suprapubic pressure, success rate 97%. And in the suprapubic pressure, where the assistant will stand. Okay, the assistant will stand against the face of the baby. So if the face of the baby towards the left side, the assistant will stand on the right side. Okay, so now the assistant at the side of the shoulders. So when the assistant will do suprapubic pressure, now he's push on or make this pressure on the shoulders. Just we will reduce the diameter of the shoulder so we can deliver it easily. Majority of the shoulder dystocia take care will be delivered with the suprapubic pressure with macropers. After that, if failed, I will assess the patient and I will consider episiotomy just to allow me to do internal maneuvers or delivery of the posterior arm. After that, all four position or repeat all the steps again. After delivery, we need to assess this patient regarding the postpartum hemorrhage. I need to manage the third stage of labor actively. I will check for any tears and I will need to do the repairs for that. I need to take cord blood sample. It's medical legality point just to check what about the pH of this baby and documentation of everything. One of the patient safety, one of the medical legality point. Team briefing with patient and partner. Incident report. If fetal injury happened or pH less than 7.2 or baby in the ICU. And we need to do skill and drill in the labor ward or in the department about how to manage the shoulder dystocia. Then ask the ST1 about the feedback, what's going well, what needs improvement, and any suggestion, and give the ST1 all the resources like RCOG guideline, some tutorials, some videos, and advise the ST1 regarding courses or workshop to manage the shoulder dystocia. Here, this is the Macropert's maneuver. We will take the thigh of the mother against the abdomen. So it's flexion and abduction. And here with the Macroperts, here the thigh here against the abdomen, and there is suprapubic pressure. And the assistant, as you see, she's on the other side of the fetal head. So, or the fetal face. So the face like that, the assistant will be on the other side. So the pressure will be on the shoulders immediately. Okay? Here, delivery of the posterior arm. We will introduce our hand on the back or over the sacrum of the mother and make like a hook and take the posterior from the elbow to take the posterior arm. And then take the or make like a complete rotation of the baby to deliver the anterior arm like the posterior one. This is the algorithm again. This is the shoulder dystocia documentation. As you see here, everything will be here. Date, time, and who is completing the form, the nurse, signature, mother's name, date of birth, hospital number, who is the consultant, called for help, staff, name, rule, okay, time arrived. Everything with timing even, because it's very important here to document every single point. Here, Macropert's maneuver, by whom, time, order, details, reasons if not performed. Okay? You will complete this, and then neonatology here arrived, when, and the name and the signature of the neonatologist as well. Okay, so this is the document. I just put this documentation form just to show you that how we gonna document everything. That's why we need a staff, a nurse, or anyone to be inside the room just to document everything. And that's it. This is the end. I wish this video is helpful for all of you. If you need any question, just post on the group. Thank you so much.